Athletes' care and rehabilitation. Athletes' care and rehabilitation are essential components of sports medicine, aimed at helping athletes and active individuals recover from injuries and return to their sport or physical activity as quickly and safely as possible. Here are some of the key aspects of athletes' care and rehabilitation. Injury assessment. The first step in athletes' care and rehabilitation is an injury assessment. Sports medicine practitioners use a range of diagnostic tools, such as imaging tests and physical exams, to determine the extent and nature of the injury. Treatment plan. Once the injury has been assessed, a treatment plan is developed. This may involve a range of interventions, such as physical therapy, medication, or surgery, depending on the nature and severity of the injury. Rehabilitation. Rehabilitation is a key component of athletes' care and rehabilitation. Sports medicine practitioners work with athletes to develop a rehabilitation program that includes exercises and other interventions to help restore function and prevent re-injury. Return to play evaluation. Before an athlete can return to their sport or physical activity, they must undergo a return to play evaluation. This evaluation includes a range of physical and functional tests to ensure that the athlete has fully recovered and is ready to safely return to their sport or physical activity. Follow-up care. Follow-up care is essential in athletes' care and rehabilitation. Sports medicine practitioners provide ongoing care and support to athletes to ensure that they continue to recover and prevent re-injury. Overall, athletes' care and rehabilitation are essential components of sports medicine, aimed at helping athletes and active individuals recover from injuries and return to their sport or physical activity as quickly and safely as possible. By providing injury assessment, treatment plans, rehabilitation, return-to-play evaluation, and follow-up care, sports medicine practitioners can help athletes achieve optimal physical performance and prevent future injuries. Contribution of physical education teachers and coaches. Physical education teachers and coaches play a crucial role in sports medicine by promoting injury prevention, recognizing and managing injuries, and helping athletes with rehabilitation and return to play. Here are some of the ways in which physical education teachers and coaches contribute to sports medicine. Injury prevention. Physical education teachers and coaches can help prevent injuries by teaching athletes proper training techniques, providing appropriate warm-up and cool-down exercises, and emphasizing the importance of hydration and nutrition. Early recognition and management of injuries. Physical education teachers and coaches can recognize early signs of injury and refer athletes to appropriate medical professionals for further evaluation and treatment. They can also provide first aid and initial injury management on the field or court. Rehabilitation. Physical education teachers and coaches can work with medical professionals to develop rehabilitation plans for athletes recovering from injuries. They can help athletes with exercises, stretching, and conditioning to improve their strength and mobility during the recovery process. Return to play. Physical education teachers and coaches can help athletes safely return to their sport or physical activity after an injury. They can work with medical professionals to ensure that athletes are fully recovered and have met all the necessary criteria before allowing them to return to play. Education and advocacy. Physical education teachers and coaches can educate athletes, parents, and the community about the importance of injury prevention, proper training techniques, and rehabilitation. They can also advocate for the use of appropriate safety equipment and facilities to reduce the risk of injury. Overall, physical education teachers and coaches play an important role in sports medicine by promoting injury prevention, recognizing and managing injuries, and helping athletes with rehabilitation and return to play. By working closely with medical professionals and advocating for safe and healthy practices, they can help athletes achieve their physical goals while minimizing the risk of injury. Prevention of sports injuries in sports. Prevention of sports injuries is a critical aspect of sports medicine, aimed at reducing the risk of injury and keeping athletes safe and healthy. Here are some strategies for preventing sports injuries in sports. Proper warm-up and cool-down. Athletes should always perform a proper warm-up and cool-down before and after exercising or participating in sports. This can help prepare the muscles and joints for activity, reduce the risk of injury, and improve performance. Proper training. Athletes should receive proper training from qualified coaches and trainers. This includes proper technique, appropriate intensity and duration of training, and progressive training over time. Appropriate equipment. Athletes should use appropriate equipment that is well fitted and in good condition. This includes helmets, pads, shoes, and other protective gear that are specific to the sport being played. Proper hydration and nutrition. Athletes should maintain proper hydration and nutrition before, during, and after exercising or participating in sports. This can help improve performance and reduce the risk of injury. Rest and recovery. Athletes should allow time for rest and recovery between workouts or competitions. This can help prevent overuse injuries and allow the body to recover and repair itself. Injury management. Athletes and coaches should have a plan in place for managing injuries when they occur. This includes seeking prompt medical attention, following a rehabilitation program, and ensuring that the athlete has fully recovered before returning to play. Overall, prevention of sports injuries is a critical aspect of sports medicine. By following proper warm-up and cool-down protocols, receiving proper training, using appropriate equipment, maintaining proper hydration and nutrition, allowing for rest and recovery, and having a plan in place for injury management, athletes can reduce their risk of injury and stay safe and healthy while participating in sports.